This is St. Vincent's Health Talk, a video magazine with the latest news and developments from St. Vincent's Health Services. In this edition, we'll give an update on our Master Facilities Plan, which includes a look inside the Michael J. Daly Center for Emergency and Trauma Care, and our new mobile mammography coach, and celebrate accolades received by our cardiology and surgical departments. At St. Vincent's, we're investing in the future and working hard to be the hospital of choice for patients, employees, and physicians. Now let's turn to our news summary. In the fall of 2009, St. Vincent's rolled out a new program to all patient units, which was piloted on 9 North and 7 East. Our Care Partner program is part of the medical center's commitment to provide a patient-centered care model by inviting family and friends to partner with us to provide the best possible care. Nina Fosti, Assistant Vice President of Patient Care Services, describes who a Care Partner is.
A care partner is a loved one. It can be a spouse, an adult child, a friend, who the patient chooses and invites to be a partner in his or her care while the patient is in the hospital. We know from patient safety literature, from our Patient and Family Advisory Board, and from just contemporary practice, the benefits of having the patient involved in his or her own care and the benefits having the family involved with the patient. And it's not only as a comfort measure, but it's actually as a safety measure. Because who knows the patient better than a loved one or a significant other? Who's able to pick up the subtle cues in the way a patient looks or the way a patient talks or the way a patient acts than somebody that knows the patient the best? So we felt it was extremely important to begin to invite family members to be part of the healthcare team.
Almost 2 years ago, St. Vincent's and the other hospitals in Connecticut began the important task of providing information to the government about the programs and events we host for those who are in need, medically vulnerable, or underserved. A hospital-wide committee representing many different departments was established to track and report the information, which the government requires be reported in dollar amounts in order for the medical center to maintain its not-for-profit status. In the fall, the Community Benefit Program was strengthened by the addition of Vice President of Mission Bill Hoey, who joined the St. Vincent's family. Here, Bill discusses the importance of community benefit.
For a number of reasons, not the least of which is so that the community understands what a wonderful resource St. Vincent's Medical Center is here in the city of Bridgeport. Beyond just the highest quality medical service, the benefit to the community reaches far and wide. It's volunteer activities that employees of the medical center engage in. It's free care. It's compassionate care of the poor. It's volunteer board activity, it's helping youth groups. Every facet of the community here in the city of Bridgeport is impacted positively by the employees of St. Vincent's Medical Center. So we try to capture that data so that we can paint an accurate picture of St. Vincent's to the community.
All employees are encouraged to report their community benefit activities to their department's representative. And now for our feature stories. In December, 2 events honoring the naming of the St. Vincent's Emergency Department took place. During the first, benefactors and board members enjoyed the unveiling of the Michael J. Daly Center for Emergency and Trauma Care at an evening reception. Mr. Daly was a longtime board member, donor, and friend of St. Vincent's. Ron Bianchi shares some of his thoughts on the ED's namesake.
Well, because Michael Daly lived the kind of a life that's really exemplary. He was a Medal of Honor winner in World War II, fighting for his country. I mean, all of us might not be here if it wasn't for people like Michael Daly. And when he came back, he gave up the heroics of war, and he became incredibly compassionate and caring and kind to people in trouble. And he spent his life being an advocate of the downtrodden, of the underserved, the poor. I mean, he's so much a part of what our mission is, our history, and he lived it every day.
The second event involved staff and volunteers enjoying an afternoon open house, which showcased the new area of the Michael J. Daly Center for Emergency and Trauma Care. Here, Dr. Jody Gerard, chairman of emergency medicine, discusses the new space.
Our current new emergency department has 2 large trauma bays, which can be expanded in the case of emergencies or disasters. We have outside another 6 medical critical care beds. And then on the other side, we have approximately 25 beds that will remain in service while we renovate next year and eventually grow into a much larger department that will have in excess of 60 beds. Well, we're very excited about this absolutely gorgeous and state-of-the-art facility. It occupies approximately an acre of square footage. We are standing right now, for instance, in one of the trauma bays that will provide state-of-the-art care for our patients in our community. We are expecting a very aggressive attempt to see patients with minimal wait. We have a gorgeous waiting room that we expect will be empty of patients and a nice place for families to stay while they're with their loved ones who are in the back being treated.
The next steps include the older section of the ED being closed off for renovations to complete the entire new department, on schedule for early 2011. Mike Caniff discusses renovations and the finished project.
We have about 2 years worth of renovations still to go. And not including not just the emergency department, we still have our GI space to complete. We have parts of radiology, non-invasive cardiology, the pre-admission testing. We have waiting areas off of the main lobby. One of the major concepts for the project is to convert the main lobby into more of a mall concept. So patients, as they enter the lobby, they can find themselves finding different points of interest very easily. For instance, when you're on your way to radiology now, there's a lot of ability to get lost. At the end of the project, you'll find a way to get to radiology, and it'll be only one way to go, and it'll end with a waiting room. So there's no more finding all different modalities within radiology, for instance. Patients going to cardiology will now enter a single waiting area for invasive and non-invasive cardiology, which generates much more of a center of excellence for cardiology. And we sort of consolidate that center itself, so it feels a little bit more robust and powerful and structured. So that's going to be a nice thing for the patients as well. It's be good for marketing as well. So,
as we put the finishing touches on the Elizabeth Freem Swim Center for Cancer Care, Health Talk will cover this momentous occasion in the next edition. Rolling with its new Swim Women's Imaging Mammography coach, outfitted with state-of-the-art digital technology and an attractive interior that will provide convenience and comfort to patients throughout the state. An example of the latest in mobile mammography, the sleek, spacious vehicle was purchased by St. Vincent's Swim across the Sound and is supported by grants from the Connecticut Challenge, from Chuck Mattis, a Foundation and Health Services Board member, and from the Swim's Breast Cancer Luncheon. Director of Women's Imaging, Dr. Kelly Harkins, describes why the coach's new technology is such a big step forward in detecting breast cancer.
Well, for years we've been using the analog, which is great, but the technology really has been proven that digital mammography is better than analog, and this is for a number of reasons. First, patients that have dense breast tissue, the digital has been shown to increase cancer detection rates, so that is important. Also, when we're out in the field, we have to bring the cassettes and develop the pictures when we get back to the medical center. Now that we have the digital technology, we can see right away whether we have the accurate imaging that we need. It also decreases the number of callbacks or patients coming back for additional imaging with the digital technology. We also can image faster, and therefore we can accommodate more patients when we're out in the field in less time, which is great.
The new coach will also mean less anxiety for women, as it offers greater comfort and privacy, according to Director of Radiology, Rachel Gelati.
It offers privacy in that you're not in an office setting where they're employed setting up a changing area in a locker room or a break room, a lunchroom. You're actually there on the coach in a totally private environment that's upfit and made to be comfortable for the patients. The mobile coach is a 38-foot motorhome with luxurious leather couches in the waiting area. It has a flat screen television, a little refrigerator for refreshments for patients, and we provide the gowns and the changing area and everything that a patient would need when they're coming to have their mammography done on the coach.
With digital technology as its centerpiece, the new Mammo coach will provide a clearer picture and save lives in the community. Our cardiology department has once again received accolades from Healthgrades, the leading independent ranking source. In 2010, St. Vincent's has been ranked #1 in Connecticut for cardiac surgery and has been awarded the Healthgrades Cardiac Surgery Excellence Award for the 3rd year in a row. Albert DeMeo, Director of Cardiovascular Minimally Invasive Surgery, discusses the award.
Well, I mean, in the sense of the award, I think it's a direct reflection of certain quality metrics that are measured and that we basically did the best in the state. But specifically as a hospital, I think we offer all the benefits of a smaller community hospital in terms of the personal care, the presence of attending physicians every day at the bedside of the patient, a really good team that's very experienced from the nursing staff up to the surgical and cardiology level. But also, in addition to the kind of small town feel that we have here, we also offer all the latest technologies and advances in cardiac surgery that patients in Fairfield County look for. From the cardiac surgery side, I think the most of the credit goes to the nursing staff and to our PAs, our physician assistants. I think really, you know, at the level of the surgeon, obviously we play an important role, but without the support staff, we would not have any of the results that we have here. But in addition to the people directly interacting with patient care, I think a lot of credit goes to other services in the hospital like blood bank, laboratory sciences, our great consulting doctors who are able to help us with difficult cases, whether it be infectious disease or pulmonary. And naturally, the cardiology department we have here is so strong that we're given a tremendous amount of support in not only getting interesting cases, but in helping take care of them after surgery.
Additionally, St. Vincent's was ranked among the top 10% in the nation for cardiac surgery for the 3rd year in a row, and was 5-star rated for the treatment of heart attack for the 8th year in a row. The Department of Surgery, specifically the specialty of gastroenterology, also received recognition from Healthgrades in 2010 as ranked among the top 5% in the nation for GI surgery. St. Vincent's was also recognized as 5-star rated for cholecystectomy and a recipient of the Healthgrades Gastrointestinal Surgery Excellence Award for the 2nd year in a row. Dr. Douglas Ross, chairman of the Department of Surgery, discusses this recognition for the GI and the gastroenterology team.
Well, what the GI surgery Healthgrades represents is really a quality measure. It represents really that we have low complication rates, we have low length of stays, we operate on the patients don't get sick from the operation, they get better, and they get better faster than most places. We're able to move them in and out of the hospital very smoothly, and just things go well, and that's because we're just prepared to do the surgery correctly. But it takes a whole team, like I just said, and it's not to downplay anyone's role in that achievement, but really the Healthgrades does represent a quality measure to us, that we do it better than other places, and it's because we have the right people.
Thanks for watching Health Talk. We leave you with some additional images of the progress being made on the new Elizabeth Freem Swim Center for Cancer Care. Our next edition of Health Talk will feature the milestone opening.